Hi there guys, and happy Monday. Welcome to today's live stream. Today we're going to be talking all about understanding your back pain from a rehabilitation point of view. So hopefully this one will be really helpful in understanding your rehab for your back. And remember to tune in tomorrow. We've got a really exciting announcement that we've been just struggling to keep quiet. So that'll be coming out tomorrow on our live stream. That's really exciting. So if we get straight into it, let's get going. So today, understanding your back pain rehab. Now, we wanted to cover this because there's a really common mistake that a lot of patients make when we see them in the clinic, and they're maybe doing the same exercises for extended periods of time. And part of this is just because the purpose of rehabilitation, the specific rehabilitation that you may be doing, hasn't necessarily been explained to you. So in today's video, we'll kind of cover a very brief bit on back pain specifically. And the same here does apply to other injuries, whether it's a shoulder, a neck, specifically the back, less so those other peripheral joints, but to a certain degree it does apply to those. So we'll cover that very briefly, but then talking about the difference in short-term and medium and long-term rehabilitation protocols. And then we'll talk a little bit about relief versus strengthening exercises, and then follow on talking kind of layering it with time and consistency, and how that relates to our Back in Shape app protocol, the membership site, which kind of, that's the what would the word be? That's how we fit all this together in our membership site, because it is really important that things are done well. So first and foremost, back pain itself. The overwhelming majority of patients that come into our clinic have back pain that's developed over an extended period of time. Now, as we've discussed in previous episodes and these live streams, it's generally that it's built up through bad practices over a long period of time, maybe ignoring something that was an ache that's progressed onto a discomfort and then become a pain, and that might have taken place over a couple of weeks, months, or even years. So understanding the time scale that your back pain is built up over, and that repeated episodes of the same problem that maybe are slightly evolving or worsening are really an extension of one longer issue rather than separate unrelated events. So that's also something to bear in mind as well. But understand that it's taken time to build up. And I use this example with if we just look at our finances. If you've built up a large debt with bad spending habits over a long period of time, say weeks, months, or even years, and then you start doing the right things to deal with that debt and pay it down, the debt doesn't go away instantly. It takes time. And the same thing with back pain, especially if we have those ingrained habits that have built up over a slightly longer period. And if you're not aware of that, it's very damaging from a point of view of motivation and positivity, because if we take back to the debt example, if you all of a sudden start saving a bit more money for a day, you don't look at the bank account and go, why am I still in debt? You understand that it's going to take a bit of time. Whereas if with your back, you do your exercises once, or try ice once, or try heat once, or for a day, and then the next morning you're still in pain, it's understandable that you're going to be a bit disenfranchised or disappointed or let down or demotivated if your expectation that was going to undo all the bad stuff that's been building up for a long period of time. That really is really a fundamental important point, because if you forget that, then your motivation is going to dip, and then you get into this cycle, as so many patients unfortunately are, where nothing ever works for me, it doesn't work, and because there's not that time that's been given, that full understanding of the problem and what is necessary to actually get it to resolve. So that's very important to have in the background. Now then we move on to the actual fundamentals of these protocols themselves. There's short-term relief exercises and there's long-term relief exercises. Now, or more so, not relief exercise, but strengthening. When it comes to back pain, we have an injury, as we've discussed time and time again, and the first port of call is to try and give a patient, you guys, the right sort of advice and guidance, some of it being stretches, some of it being exercises, some of it being a mix or abstinence of certain activities, to reduce the inflammation and allow the body to start putting that scab together so that the inflammation calms down and there's not that prohibition of movement through severe symptoms. But that doesn't always eliminate the pain. And then we need to move on, so we're able to move on to the strengthening stuff, which is really important for actually dealing with the deeper problem. But if we continue doing the relief-based exercises that we've seen, if we take the example of the membership site, we've got the basic protocol, which has phase 1. The phase 1 exercises should really be done for a couple of days before moving on to the phase 2 exercises. It might be 7 days or 14 days for some individuals. It might be a little bit less for others, until you can start moving into some of those more active exercises. If we're continually just doing phase 1 exercises for a month or so, they are good. They do actually relieve the stresses and strains that go through our spine. And if we're conscientious about some of the other tips and tricks in the phase 1 membership information, then you will do well and reduce your symptoms, but you're not really making any changes. So your back's not stronger, it's not doing any of that. You're just stopping doing the dangerous things and keeping your back in a reasonably good condition and helping it heal, but we're not doing anything to stop it coming back in the future. So then you do those exercises routinely, religiously, for a period of a month, but then it comes back after 3 weeks. Well, that can then cause you to be disenfranchised because you think, oh, well, those exercises didn't work. But those exercises weren't doing anything to stop it coming back. Those exercises were the relief-based exercises. So understanding what is the purpose of the exercise phase regime program that you're doing right now and what is it achieving is really, really important, so that you understand when is the right time to move on and when is the right time to stick on those exercises. And if you haven't managed to get enough progress with strengthening and rehabilitation work, sometimes it's necessary, if you do have an unfortunate event, to take a step back and just do those relief exercises for a few days and then jump back into your strengthening based protocols. So it's understanding that the relief based exercises do not deal with the long-term problem, they just help getting you to a point where you can. And that then moves into the exercises, for example, in the membership site, the phase 2 exercises, and this is strengthening. Strengthening is really the most important thing. Now, when we talk about doing strengthening exercises, they need to be safe. There's lots of different exercises that strengthen the body up, but may not necessarily be appropriate for you if you've got a certain problem. Maybe it's a L5S1 disc or some sort of spondylosis in the lower part of your lumbar spine. So we want to use the right strengthening exercises, but it's those strengthening exercises done over a period of 3 months, 12 weeks, something like that, that actually allow you to make a measurable improvement in the strength and the stability of those structures that protect your spine, and that is the lumbar muscles, the core muscles, the hips, etc. And that distinction between the phase 2 exercises that strengthen and deal with a problem and the relief-based exercises that are there to calm down the inflammation and allow you to be able to do those phase 2 exercises is really, really important. Now, the second thing is time scales when we get to the phase 2 exercises, the strengthening exercises. When we're teenagers, we can grow muscle and we can adapt very, very quickly. But a lot of people with back pain aren't teenagers. They're people that are maybe in their 20s and 30s or a little bit older than that as well, that are a little bit slower. And obviously, the older you are, the slower your body's ability to adapt to new stresses and strains. And that is the purpose of a strengthening protocol. It's there to cause your body to adapt to increased strain so that it can more effectively deal with that increased strain without failing and buckling under that strain. So that's very important, that it takes a bit of time. But the research on this is very, very positive. Being consistent over an extended period of time, 12 weeks, 3 months, can massively improve the strength and rigidity, the strength and stability of your spine so that it is much, much, much less vulnerable. But the important thing is there has to be that consistent approach. It's not always a linear improvement, and that's also important to understand, but you will make improvement over that 3-month period if you are consistent with the exercises and doing them daily, following your protocols and not slipping back into old habits. So that is really, really important. And that's pretty much it we have to say for today's video. Really wanted to just cover that, but we'll recap it in overview one more time for you guys, just so you get the general gist of things. Most back pain is cumulative. It's built up over a long period of time, so we need to address that. We need to have the appropriate time estimations with regards to how long it's going to take us to recover. The next thing is that there are short-term relief-based exercises which do not do anything to deal with the underlying consequences, but they do the right things to allow that body to start that healing process well. And those should be done in the short term until you are able to start doing some element of strengthening based exercises. And then over the subsequent 6, 8, 12 weeks and longer, we should be doing a progressive, i.e. you should be doing more at the end than you were at the start, strengthening regime that is improving the supporting structures for your spine and therefore protecting it for the medium and long term. And you require a degree of time for this to take place, especially if we're slightly older because we're less adaptive. and you require the consistency, doing it day in, day out for that same time frame, and not slipping back into previous bad habits for this thing to be as effective as it otherwise could be. And that is basically the principles that overarch the Back in Shape membership site, the phase 1, the phase 2, the premium, the basic protocols, so that you can effectively deal with your back pain, because too many people overlook these things and either get stuck doing phase 1 exercises for extended periods, wondering why things keep coming back. They don't adhere to any of the strengthening exercises and just don't get that resolution. So hopefully this video has been particularly helpful in helping you understand why you're doing those exercises, because understanding why you're doing a specific exercise or a specific protocol is really helpful in understanding why are you doing it and when should you stop doing it and move on to something else. So hope you found that helpful, and we'll move on to Q&A for today's live stream.
Just one quick question.
Yep.
Would you mind just clarifying how long we should stay in phase 1 for?
There is a bit of a dependence on the individual for that, because if you're in, but I generally look at the ability to do exercise. So we had someone the other day who said, I've been doing phase 1 exercises for the last month or so, but I've been walking 5 miles a day. If you're walking 5 miles a day, you should not be doing phase 1 exercises. You should be doing phase 2 exercises. So phase 1 is really for the person. I spoke to another lady a couple of weeks ago who cannot move. Like, you can't, moving around the house is a struggle. It's a challenge. I'm in a lot of pain. I can't move. I can't do anything. I can't go to the kitchen without being in pain, severe pain that stops me doing that. If we're able to start getting out and about, walking around the block, for example, you should be going on to the strengthening based exercises, because you're going to be doing more challenging tasks. So it's generally a degree of when should you move on to the next exercise is generally based on your personal ability to do things. So if you can go for a short walk and you're able to be up and about and be mobile but have pain, you should start to consider moving on to the phase 2 exercises and test them. The phase 2 exercise, we've got 2 stages in the Back in Shape membership site. We've got the body weight ones, which are very, very simplistic. It'll take you around about, for the average person, it might take 10 to 15 minutes to do the strengthening component. There's obviously the stretching part afterwards. But it's a nice little stepping stone to move on. And it might be that you're supposed to do 10 reps, but you only do 5. But it's better to move on to that once you're able to do some level of activity than just get stuck in the phase 1 exercises, the relief-based exercises, because that can almost be this kind of glass ceiling. People are scared to actually get out of phase 1 because they don't want to injure themselves. But I would stress the exercises that we've put in the phase 2 are the best ones you could possibly do if you've got a bad back.
Ollie's just asked a really good question. If
Yep.
my pain goes away before I finish phase 1, which we've had
a lot of people saying that.
Yeah, phase 1's really good. Should I just stop, or should I go on to phase 2?
You should go on to phase 2. The whole point is, so the question was, if my pain goes away in phase 1, should I just stop? And the answer to that is, well, no, of course not, because the phase 1 was to reduce your inflammation. The inflammation has come down because there's no pain there, but your body is now going to be going through that remodeling and recovery process, whereby it's laying down that, it's already laid down that sort of scab tissue around there, so there's no inflammation anymore, or very little, and it's not enough to give you the pain. But now those tissues need to remodel under stress and under strain to allow them to return to their normal tensile strength. Injuries in the back we don't have a very good mental awareness of the progress of those, like we would if we had a cut on our skin. We could see it doesn't hurt anymore when I press it, but there's still a massive scab here. Obviously it hasn't healed. Well, that's that person that says, I feel better after doing the phase 1 exercises. It's time to move on to phase 2. And that's how you deal with it more effectively. Whereas the person that goes, I feel better, that's that person I mentioned earlier. They feel better doing the exercises, I feel good, and then they come back. And then I feel good because I did the exercises, and then they come back. That's that person that's stuck in the perpetual cycle of phase 1. And unfortunately, when that happens more than a couple of times, you start to then question, did the exercises work? The exercises don't work for me. And those patients it's really sad to see that kind of mentality. Nothing works for me. I've tried it. I felt better, and then I got worse again. And the problem is you just haven't moved onto the next set of exercises. And once someone gets into that mentality, it's actually really damaging from their recovery process, because they start getting all these disempowering beliefs. So I would seriously encourage you, if you're feeling better, fantastic, tell us, because we love to hear that, but move on to the phase 2 stuff, because that's where the strengthening takes place. And it's not always going to be a smooth road. You need to get stronger. But yeah.
Yeah, there's always more that you can be doing,
Yeah,
and
definitely.
more that we can add on.
Definitely.
Great analogies today. I really like the one about the financial debt.
Yeah, well, it helps people understand it.
Another very specific question from a lady. She said, so she's in the phase 1, but she's currently torn. She's got the torn muscle in her stomach down the right side. So she's just not sure whether she should be doing the exercises.
So it depends on to what degree the muscle is torn. So there's lots of different stages. If it's and I probably can't pursue all of these particular questions in this video without talking in an actual conversation about this, but I'll throw a few hypotheses around here. Number one, if the muscle was it on the muscle, the stomach muscle, the core?
Yeah, stomach muscle down the right side.
Yeah. So if it's torn, properly torn, and you shouldn't do the exercises, that would be if there's a massive bruise. So when we tear muscles properly, you have a massive bruise. Now, if the muscle's got some issues with it, it's not functioning as well as it should be, and there's maybe a little bit of a strain on the muscle, that's a different kettle of fish. That may mean that actually there's just a little bit of strain because those muscles are working hard, because they're not strong enough to protect the back, and that might be a little bit different. And in that case, it might actually be worth seeing how do the core engagement and the psoas engagement exercises work. If they're doing okay and it's manageable and it's not getting any worse, then actually considering trying the phase 2 exercises might actually be the way to go, or at least having a look at those to see how you can incorporate those, because not all of the phase 2 exercises just involve that segment. In some respects, it might even be more important, because if you're not actually progressing onto the phase 2 exercise because there's a strain on the muscle on the one side, and it's not torn to the degree I mentioned at the start, then you will require the other muscles to almost overcompensate to deal with a fundamental weakness in that right hand side core muscle, and therefore it would probably be more necessary that we strengthen up some of the other muscles so they can overcompensate whilst that core muscle is recovering, so they can take some load off. For example, the lower back muscles, the leg muscles, the upper and middle back muscles can provide a little bit of extra support so that core can actually start to heal up a little bit more effectively. So there's rationale to actually consider maybe that's more of a reason to move on to something a bit more direct, and you just take the core component of exercises a little bit easier.
Okay, interesting. A couple more questions here. Joe's asked, what if I've tried strengthening but I still get pain?
I'd suggest 2 things. One, have you tried these exercises? Is the first question, because they're different. They're not the same normal exercises. And I'd also question, what was strengthening? What was the actual strengthening that you did? Because we often get patients coming in saying, I'm doing strengthening exercises, and they're doing something like knee hugs. Well, that's not a strengthening exercise. It's been exactly, and it's not a good stretch, not one you should be doing in our opinion, especially with a lower back problem. But often that perception, is this exercise actually a strengthening exercise, or is it a mobility exercise? A knee hug would probably be classified as a mobility exercise rather than a strengthening exercise. So I would say that it's if you have been doing the correct strengthening exercises that we would endorse, and you still haven't been getting any better, then I'd first look at, have you been following all of the other advice, the other bits, the stop doing these things? Because if you're still making all those mistakes and all those other things on a daily basis, then your back's not going to get better, even if you try as hard as you can. If you're sat in a chair slouched for 12 hours a day, it doesn't matter what you do, you're going to have back pain. There's no two ways about it. So I'd look at that as well. And if you're doing everything perfect at home, you're not doing any mistakes, and you've been doing a strength program for a consistent period of time, longer than a couple of weeks, and you're not getting better, then unfortunately you might be one of those patients that actually do need to get in to get some treatment, and a little bit more direct advice. And if you then say, well, I've tried treatment, a lot of the patients that we see have tried treatment before. They've tried osteopathy, physiotherapy, acupuncture, cupping, needles, all those sorts of things. But the stuff that we do in the clinic, that's why we do what we do.
Yeah, okay, perfect. And one last question. Are the exercises suitable for all types of back pain? Are there any cases these wouldn't be recommended for?
Probably. So if you've seen any of our other videos, the overwhelming majority of back pain problems are caused by, in order to injure a structure, it needs to fail under its role. And the main role of a lower back is to weight bear, to resist the load of gravity. So the overwhelming majority of patients will injure their back through excess compressive load in some way. And for those people, yes, these exercises are all appropriate. That's specifically why we've chosen them. There are a certain few that they wouldn't be appropriate for, and that might be the patient that was in a parachuting accident, where as they came out of the parachute got caught in a tree and suddenly stretched all the spine. And we can all agree that is a highly unlikely set of circumstances. It's very, very rare. Most back pain is caused by excessive compression in a short period of time or over an extended period of time, and these exercises remedy those issues. It's highly unlikely that you've injured your back in any other way, like what I just mentioned, which may have been an excessive stretch or traction or some other sort of injury that's out of the ordinary, doesn't involve a degree of passive load. If you were bent forwards too much, that's compressive load. If you bent backwards too much, that's compressive load. If you were carrying something, that's compressive load. If you were bending and twisting, that's compressive load. If you sat for long periods, that's compressive load. It's only the very few set of circumstances where there's something more going on, which wouldn't be applicable for. And that, again, would be a question for asking us directly, what have you specifically done that you think maybe means it might not apply to you. But that's the whole reason we do these exercises. They're based on the thousands of patients that we've seen in the clinic, the thousands of accompanying images of those patients' lower backs, to understand what the problem is, and drawing all of that information in to distill it to the protocols that we do. So it's not something we just popped off the top of our head. This is based on the large experience that we've had in the clinic, seeing these patients with imaging. That's the important distinction, I suppose, between us and the people that would recommend different exercises. They don't work closely with imaging, are definitely not on the same volume. And that imaging, the understanding of the patient with the appropriate imaging, is what really gives you the understanding.
Perfect.
And maybe that's a topic for next live stream, because a lot of people might then ask, well, why x-rays and not MRIs? And we can maybe talk about that on another live stream, because that would probably be a very interesting one for a lot of people.
Wonderful.
Awesome. Well, thanks again for today's live stream. Hope you found it helpful, and thank you for all the questions, as we're really appreciated. We look forward to seeing you tomorrow with an exciting announcement. But until then, have a great day. Thanks for watching.